Good evening, everybody. My name is Agam Jung, and I'm a consultant neurologist at Leeds Teaching Hospitals NHS Trust, and I lead the MND service there. And of course, as you may have heard, as you already know, we are building the most beautiful Rob Burrow Centre for motor neuron disease. The journey has been long, and it actually goes back to 2011 when I started, when I joined the team and took over the MND service. I had a vision about about how care needs to be delivered. I wanted to make sure that the patient was at the center of everything, and there would be different layers of people, professionals surrounding that patient who would be providing care as and when it was needed. In the first instance, there would be the GP, along with the neurologist, a palliative care physician, and a specialist nurse. Then the second layer of professionals would include all the therapists, including those in the community, and of course an outer layer of a gastroenterologist, an anesthetist, a respiratory physician, and a clinical geneticist. And all of this would sit within a dedicated center for motor neuron disease. I drew this in 2011 in a building, the Medical Illustration House, which coincidentally is the exact location of where the Rob Burrow Centre for Motor Neuron Disease is being made. Over the years, we've seen a steady increase in the numbers, and in 2024 now itself, I've received 16 referrals, about one referral every week, and this has been a steady increase of patients overall. I deliver care from Seacroft Hospital, which is quite old, and there were two incidents that took place in March 2020, which led to my developing the concept of the Rob Burrow Centre. The first thing that happened was that one of my patients refused to have a drink of water because there was no hoist in the toilet, and they felt they would not be able to use the toilet. My occupational therapist, Sarah, asked me if I could request a hospital's charity for about £10,000 to £12,000 for a hoist in the toilet. The second thing that happened was that Rob Burrow asked me if I followed rugby, and of course I laughed and said no. He said, "Any sport, Dr. Jung?" And I said, "Not at all." And then I went on to tell him about the two matches that I've seen, one of course being cricket at Headingley Stadium, and another one secondary to an incident which took place when I was a junior doctor. I'm of Indian origin and an immigrant, and when I came to the country, I'd never heard of rugby. In A&E in Pontefract, a patient came to me with a hand injury, and I asked him, "How did you get this injury?" And he said, "I was in a scrum." And I said, "So what is a scrum?" And he laughed and he said, "Oh, it's when lots of blokes get together and bash each other up." And I was suitably embarrassed because I didn't know what a scrum was. And when I told this about this incident to the other colleagues, there was good-natured banter, and one of the nurses took pity on me and said, "Dr. Jung, there's a game on, why don't you come along with your family and watch it?" My husband, myself, and 4-year-old daughter, we went and watched this game. And as I was telling Rob about this, Rob looked up at me and said, "You've seen me play, Dr. Jung." And I said, "Can't be, it was so long ago." He was quite insistent that I had seen him play, and on that weekend I had a bit of a meltdown, you can say. I had not planned to come to the UK. I was a general physician in my previous lifetime, and I had drifted into neurology. I had trained in neurological infectious diseases as a subspecialty, and here I was doing motor neuron disease, and our parallel universes had collided in March 2020. It was a difficult period for me, and on Monday morning I sent an email back to the occupational therapist saying, "Forget the £12,000 that you want me to ask the charity for a hoist. We are going to ask for the neuromuscular centre housing the Rob Burrow Centre for Motor Neuron Disease." So why did I not ask for an MND centre in the first place? I'm not a neuromuscular expert. I did that because I thought nobody knew about MND and nobody really cared about MND. And of course, Rob then changed the whole narrative around motor neuron disease. The whole perspective has changed, and here we are, brilliant fundraising ongoing. We need to raise 6.8 million, I think, and I think I can't thank all of you enough. I don't think I'll be able to meet, there are strangers putting in money into this place, and I hope that we'll be able to open the doors later this year, and I'm really grateful to all of you for this. In Rob's words, "In times of adversity, we must dare to dream." And here we are, dreaming about the centre, which is going to become a reality very, very soon. Thank you.